Hey, it's Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays. For Black History Month, we're continuing our Black in the Day mini-series, and today we're talking about eugenics and forced sterilization as a foundation that still affects reproductive health today. So let's get into it. So I learned eugenics in college, shout out to Dr. Fatima Jackson, and it was very surprising, but not really surprising, but also very heavy, because Black, Brown, and Indigenous people have had such a layered, complex, and deeply disturbing history in the United States when it comes to how our bodies have been studied, controlled, exploited, and eugenics was one of the clearest examples of that. Eugenics was built on the idea that society could be improved by controlling reproduction, so deciding who should have children and who shouldn't. And in the US, this belief was embedded into public health policy for decades, shaping who had access to care, who was believed, and who was permanently harmed in the name of health. And by the early 1900s, more than 30 states had passed sterilization laws. And these laws allowed the state to permanently end someone's ability to have children if they were labeled unfit. And that label fell most heavily on Black and Indigenous women, poor women, disabled people, and incarcerated people. In 1927, the Supreme Court made this violence legal in a case called Buck versus Bell. The court ruled that forced sterilization was constitutional, and in doing so, gave public health institutions legal cover to continue these practices for decades. That decision shaped policy, practice, and it shaped who was seen as deserving of reproductive autonomy. Forced sterilization followed lines of race, class, and disability, right? And it was concentrated in communities that already carried the greatest health burden. In the South, many Black women later described going into hospitals for routine procedures and waking up unable to have children, a practice that became known as the Mississippi appendectomy. Their bodies were treated as something to manage and control instead of people who deserved to be informed, respected, and given a choice. And in the 1970s, the Ruff sisters, two young Black girls in Alabama, were sterilized without their mother's informed consent. So when we talk about reproductive health today, we have to stop treating distress as irrational, right? What we're really seeing is historical memory. Forced sterilization represents a structural exposure, right? It was repeated harm imposed through institutions. And research shows that this kind of exposure has long-term health consequences. Studies on medical mistrust have found that Black Americans report higher levels of distrust in healthcare systems. And this mistrust is linked to delayed care, fewer preventative visits, and lower engagement with reproductive health services. That mistrust doesn't come from anywhere, right? It's shaped by histories of coercion and non-consensual care. And studies on intergenerational trauma show that historical reproductive violence is associated with changes in how families engage with healthcare across generations. Because of this, we are more likely to enter prenatal care later, we're more likely to report not being listened to by providers, and we're more likely to experience adverse maternal health outcomes. And so this is quite literally historical exposure shaping present-day risk. Disabled people were also disproportionately sterilized under eugenic policies based on the assumption that disability itself was a public health problem, an idea that still influences how disabled patients are treated and believed in medicine today. And even though eugenics is no longer named that way, research shows that Black women today are still more likely to report feeling pressured in reproductive health decisions, particularly around contraception and sterilization. So even though the language has changed, the logic hasn't fully disappeared. We still see echoes of eugenic thinking and how pain is dismissed, how reproductive choices are questioned, and how some bodies are monitored more closely than they're protected. So when we talk about reproductive justice, we're not just talking about rights, we're talking about health shaped by policy, by power, and by memory. That is this week's Black in the Day episode. I will see y'all next week. Bye.